right, Nate's gonna do some wall walks. We're restoring shoulder range of motion. So we're collectively putting positives and negatives together, meaning active range of motion against gravity, and then doing some eccentric control. So he'll show you what I'm talking about. Nate starts to lose it right there, meaning good form. So prior to him losing that scapular position, I would have him grab on the wall. Now he's gonna passively walk up the wall, or more active assisted, stretch his shoulder. So we're just getting a nice pull in through here. You feel that, Nate? Mm-hmm. Good. And then to start working eccentric control, when our arm's nice and weak after shoulder surgery, we just slide it down. Keep the weight of the hand a little further on the wall there, Nate. Get your shoulder blade down and in. Set your lower trap. I want your thumb pointing up towards the ceiling before you let go of the wall. Good. And then off the wall, we're going to do a negative or some eccentric control. So this is kind of putting together better movement patterns. So I really want Nate to learn how to not hike his shoulder. So he's allowed to practice against gravity with only what he can do with good movement. So I'll have him setting his lower trap, not arching your back, but pinching your lower trap down and in. Leading with the thumb. Start flexion. Right around there is where you start substituting. So now I'm going to allow you to give yourself a good stretch before we finish the exercise. So then he just walks it up the wall to stretch. Give himself a good stretch. Good. And then we'll start. I wouldn't want him to let go up there because I think he'd have a lot of upper trap substitution. So we're going to slide his arm down the wall. And right around here, he's going to start converting to more of an externally rotated position or thumb up. Set your shoulder blade down and in. And then come back off the wall and then control the range of motion. Good. So we're just teaching him how to move, and when we can't do the whole range of motion against gravity without substituting, we use the wall for the in-between part. So we're putting concentrics or against gravity with what I call eccentrics so that we start strengthening the shoulder through the range of motion but with better movement patterns.